9 herbs to reduce the pain of arthritis. Millions of individuals worldwide suffer from arthritis, a prevalent condition marked by joint inflammation, pain, and stiffness. Although traditional therapy, including corticosteroids, ansatses, and nonsteroidal anti-inflammatory pharmaceuticals, can help control symptoms, many people look for alternative therapies to supplement or replace prescriptions. Many cultures have traditionally employed herbal medicines to reduce inflammation and pain associated with arthritis, providing natural alternatives that may have fewer negative effects. This movie examines 9 plants that are well known for their alleged capacity to alleviate arthritis pain. Every herb, from devil's claw and bromelain to turmeric and ginger, has special components that are thought to have analgesic, antioxidant, and anti-inflammatory effects. Although there is conflicting scientific data on these herbs' effectiveness, their historical application and anecdotal accounts call for more research into their possible significance in the treatment of arthritis. Come along with us as we explore natural ways to alleviate the symptoms of arthritis. Remember to subscribe for more enlightening videos about holistic health advice and herbal cures. 1. Turmeric researchers believe that curcumin, a chemical found in turmeric, which is frequently praised as a powerful herb in traditional medicine, helps explain the plant's anti-inflammatory and pain-relieving effects. The potential advantages of turmeric for the treatment of arthritis pain have been the subject of numerous studies. Numerous inflammatory pathways in the body, including those implicated in arthritis, have been shown to be inhibited by curcumin. Turmeric may help reduce arthritis-related joint pain, stiffness, and edema by lowering inflammation. Additionally, the antioxidant qualities of turmeric can aid in scavenging dangerous free radicals, which are linked to the development of arthritis. Increased pain and inflammation in the joints might result from free radical damage to the cells and tissues. Turmeric has the potential to protect joint health and lessen the symptoms of arthritis by scavenging these free radicals. Many individuals use turmeric as a natural supplement or spice in their cooking. And while research on its effectiveness in treating arthritis is still ongoing, many report varied degrees of pain alleviation. 2. Ginger, the anti-inflammatory and analgesic properties of ginger, a common culinary spice with a long history of medical usage, are thought to be attributed to molecules like gingerol and shogaol. According to studies, ginger can prevent the synthesis of inflammatory enzymes and cytokines, which are important in the etiology of arthritis. Ginger may help reduce pain, swelling, and stiffness in arthritic joints by lowering inflammation. Antioxidants found in ginger can also help shield joint tissues from oxidative injury. Increased oxidative stress is linked to arthritis and can worsen joint inflammation and tissue degradation. By scavenging free radicals, ginger's antioxidants lower oxidative stress and may even decrease the course of arthritis. Although the exact processes behind ginger's effects on arthritis require further study, many people find that adding ginger to their diet or taking pills helps to reduce their symptoms. Before beginning any new supplementation program, it's crucial to speak with a healthcare provider, particularly if you are using medication or have pre-existing medical conditions. The third, Boswellia. In traditional medicine, Boswellia, often called Indian frankincense, has been used for ages to treat a variety of inflammatory diseases, including arthritis. Boswellic acids, which are found in the resin of the Boswellia tree, are thought to have anti-inflammatory qualities. By blocking pro-inflammatory enzymes like 5-lipoxygenase and 5-LX, these acids lower the synthesis of inflammatory mediators that fuel inflammation and discomfort in arthritis. Numerous research have looked into how well Boswellia extract works to reduce the symptoms of arthritis, with encouraging findings. According to research, Boswellia may aid people with rheumatoid arthritis and osteoarthritis by reducing swelling, discomfort, and joint function. Additionally, as compared to traditional arthritis treatments, Boswellia is typically well tolerated and linked with few side effects. Before beginning a Boswellia supplement, it is imperative to speak with a healthcare provider, particularly if you have underlying medical concerns or are currently taking other medications. Although Boswellia has shown promise as a natural treatment for arthritis pain, further study is required to completely comprehend its long-term benefits and mechanisms of action. Fourth, capsaicin. The key ingredient in chili peppers that gives them their heat, capsaicin, is frequently applied externally in lotions and ointments to reduce arthritic pain. In reality, capsaicin acts by desensitizing genuine bone receptors, which are nerve receptors involved in sending pain signals to the brain, despite its fiery reputation. These receptors are first stimulated when capsaicin is administered to the skin over arthritic joints, producing a burning feeling. But over time, capsaicin lowers nerve endings' capacity to convey pain signals by depleting the neurotransmitter chemical EP. Over time, this leads to a reduction in the sense of pain associated with arthritis. Topical capsaicin has been shown in numerous studies to be effective in reducing the onset, intensity, stiffness, and joint function of arthritic pain. Additionally, compared to oral drugs, capsaicin typically has less systemic adverse effects because it acts locally at the site of application. Capsaicin products must be used exactly as prescribed, though, and should not be applied to injured or irritated skin. A healthcare provider should always be consulted before beginning a new arthritis treatment plan. 5. Green tea, strong antioxidants called polyphenols, especially a catechin called epigallocatechin, are found in green tea, which is well known for its health advantages. 3. These polyphenols, gallet and ecogec, have anti-inflammatory qualities that may lessen the symptoms of arthritis. The onset and progression of arthritis are significantly influenced by inflammation, which results in joint destruction, discomfort, and swelling. Green tea's polyphenols have been demonstrated in studies to suppress inflammatory pathways and lower the synthesis of inflammatory cytokines and arthritis-related enzymes. Among other types of arthritis, such as osteoarthritis and rheumatoid arthritis, green tea may reduce joint pain and stiffness by reducing inflammation and regulating the immune system. Furthermore, the antioxidant qualities of green tea can aid in shielding joint tissues from free radical-induced oxidative damage. In arthritis, this oxidative stress leads to joint inflammation and cartilage deterioration. Green tea polyphenols may help maintain joint health and decrease the progression of arthritis by scavenging free radicals. Beyond helping to manage arthritis, incorporating green tea into your regular routine may have other health benefits. Yix, devil's claw. Due to its analgesic and anti-inflammatory qualities, devil's claw, a plant indigenous to southern Africa, has long been used in traditional medicine. Harpogicides and other active ingredients are thought to be part of its medicinal benefits. Devil's claw is frequently used to reduce arthritis pain, especially in rheumatoid arthritis and osteoarthritis. According to research, devil's claw may prevent the synthesis of inflammatory chemicals that contribute to the inflammatory process that underlies arthritis, such as prostaglandins and leukotrienes. Devil's claw helps relieve arthritis-related joint pain, stiffness, and edema by lowering inflammation. Furthermore, by obstructing pain impulses in the neurological system, devil's claw may also have analgesic benefits. Supplementing with devil's claw has been shown in certain trials to significantly reduce the symptoms of arthritis. However, further research is required to completely understand its mechanisms of action and efficacy. Before adding devil's claw to your arthritis treatment regimen, it is crucial to speak with a healthcare provider, just like you would with any herbal product. 7. The claw of the cat. For generations, traditional medicine has utilized cat's claw, a woody vine indigenous to the Amazon jungle, to treat a variety of conditions, including arthritis. Alkaloids, flavonoids, and tannins are among its active ingredients, which are thought to support its immunomodulatory and anti-inflammatory properties. According to research, cat's claw may reduce the synthesis of inflammatory chemicals linked to arthritis by blocking the activity of pro-inflammatory enzymes such as lipoxygenase, cyclooxygenase, and CUCX. Cat's claw can help reduce joint pain and inflammation brought on by diseases like rheumatoid arthritis by regulating the immune system. Cat's claw also has antioxidant qualities, which help to scavenge free radicals and lessen oxidative stress in the joints. Cat's claw may help protect joint tissues and reduce the progression of arthritis by neutralizing free radicals, as oxidative stress is a contributing factor to inflammation and cartilage degeneration. Anecdotal evidence and traditional use point to cat's claw's promise as a natural treatment for arthritis pain, despite the paucity of research on the subject. Its safety and effectiveness must be confirmed by additional research, though. Before beginning a new supplement regimen, always get medical advice, especially if you are taking medication or have underlying medical conditions. 8. Nettle stinging. Because of its possible anti-inflammatory qualities, stinging nettle, a plant with serrated leaves that can irritate skin when touched, has been used in traditional medicine. Flavonoids, polyphenols, and carotenoids are among the bioactive substances it contains, and these are thought to support its therapeutic benefits. Research indicates that stinging nettle may suppress inflammatory pathways and lower the synthesis of pro-inflammatory cytokines and arthritis-related enzymes. Stinging nettle helps reduce joint pain, swelling, and stiffness linked to a variety of arthritis types, including as rheumatoid arthritis and osteoarthritis, by reducing inflammation and regulating the immune system. The natural analgesic and antihistamine substances found in stinging nettle may further add to its analgesic benefits. Supplementing with stinging nettle may help reduce the symptoms of arthritis, according to some research, but further research is required to determine its safety and effectiveness. Even though stinging nettle is usually seen to be safe for most people when taken in moderation, it's important to speak with a healthcare provider before beginning any new supplement regimen, particularly if you are taking medication or have underlying medical conditions. 9. Bromelain pineapple stems and juice contain a blend of proteolytic enzymes called bromelain, which has drawn interest due to its possible analgesic and anti-inflammatory effects. According to research, bromelain may lessen arthritis pain by modifying immune responses, lowering inflammation, and preventing the synthesis of inflammatory chemicals. It is thought that bromelain functions by dissolving proteins that cause arthritic joints to enlarge and become inflamed. Bromelain helps reduce inflammation, which helps ease joint pain, stiffness, and swelling in a variety of arthritis conditions, including as rheumatoid arthritis and osteoarthritis. Furthermore, the pain-relieving properties of bromelain may possibly be attributed to its capacity to enhance circulation and decrease platelet aggregation. Improving blood flow to afflicted joints can ease pain and encourage healing. Despite the paucity of research on bromelain for arthritis, certain trials have demonstrated encouraging outcomes in terms of joint function improvement and pain reduction. To completely comprehend its methods of action and ethics in the treatment of arthritis, more research is necessary. Before adding bromelain to your arthritis treatment regimen, like with any supplement, it's crucial to speak with a healthcare provider, particularly if you are taking medication or have pre-existing medical conditions. In brief, in conclusion, arthritis is a common ailment that causes joint pain and inflammation, leading many people to look for alternative treatments. 9 herbs, turmeric, ginger, Boswellia, capsaicin, green tea, devil's claw, cat's claw, stinging nettle, and bromelain, that are frequently used to treat arthritic pain have been covered in this video. Every herb contains different components that may help reduce the symptoms of arthritis. These compounds include analgesic, antioxidant, and anti-inflammatory qualities. Although there is conflicting scientific evidence on these herbs' effectiveness, many people feel that using them helps them manage their arthritis pain. Although more research is required to fully understand the mechanisms of action and long-term effects of these herbs in treating arthritis, it is imperative that you speak with a healthcare provider before implementing any herbal remedies into your arthritis management plan, particularly if you are taking medication or have underlying medical conditions. Come explore the possibilities of herbal medicine with us and subscribe to our channel for more enlightening videos about natural treatments and holistic health.